The most common hand injuries are either fractures or damage to tendons or ligaments. So they're always related to some sort of a fall. And most of the injuries around the hand and the wrist tend to involve a lot of the wrist bones as well. But fractures, I think, is probably the ones that are commonest here. Severity varies, but you can have severities in terms of a really nasty fracture where it's not just a simple crack across the bone and you have two big chunks of bone that you can still maybe fix or something like that. But if where the bone is in lots of pieces. But that's one aspect of severity. Another aspect of severity is how many things are damaged. So you may have a fracture and it may be associated with damage to the blood vessels or to the nerves around that particular area, and that therefore makes it a much more severe type of injury. You could have what we call an open fracture, in other words, a break in the bone, but also a breach in the skin. So the skin is cut. And that just means there is a higher risk of infection. So the severity of the injuries is more in these cases. So there are lots of things that can change the severity of the injury. And they are something that whoever you seek advice from, if you injure your hand or your wrist, will be specially trained to look out for all of these things. Really, if you're asking specifically about surgery, and if we're saying that most of the common injuries are associated with fractures, then really the most common hand surgery is going to be fixation of a fracture. And that's depending on which bone and where it is. That may be what we call open reduction and internal fixation. So making a cut, getting down to the bone, putting things back where they belong and fixing it on the inside, maybe with a plate and screws. Or closed reduction and wiring. So sometimes we can pull things back into the right place and put wires from the outside to hold everything in place. And these, I suppose, are the most typical surgeries in and around the hand. If you tear tendons, then that is often involves a repair of the tendon. So you have to open up, you find the two ends and you stitch them back. If it's an old presentation, so the injury happened a long time ago, you may have to reconstruct rather than directly repair a tendon. So it all depends, but I think the commonest probably is fixation of a fracture. The commonest relating to sports, I see two aspects. Around the hand itself is a fracture in the metacarpals. These are the bones in the palm of the hand, and especially the little finger metacarpal in boxing. So if you are an amateur boxer and not properly trained, or you have the appropriate equipment, punching in the wrong way can lead to fractures in the hand. The other type of injury that I see with sports is very much related to fractures around the wrist. So whether it's a running sport or whatever, but falling and tripping and falling on an outstretched hand can cause injury to either the forearm bones near the wrist or the wrist bones themselves. And those are kind of the commonest things that I see and I treat. In terms of looking more at ligament injuries around the hand, you see those more with skiing or shooting, because you have the ski poles or the recoil of the gun that can cause damage to ligaments around, for example, around the thumb or something like that. So those are the kind of the commonest things we tend to see. The simple answer is surgery always required? The answer is no. And in fact, a lot of things can be treated without surgery. And that may be with manipulating things into place and holding them in plaster or holding them in special type of splints and so on until they heal. So that's the simple answer. But surgery is required for certain things that we know are not going to heal. So a displaced fracture that's moved out of place and we can't just pull it back into place. If we leave it, it'll heal in the wrong position. So we have to get it back into place. If you have a torn tendon, then the two ends are extremely unlikely to come back together and they need stitching, and that sort of ends up requiring surgery. Injections in the concept of injuries is very rare. You can have injections when you have conditions like tendinitis and so on. But those conditions I don't see specifically related to injury. They may be related to kind of repetitive type injuries, but not a one-off fall or one-off kind of maybe a laceration to the hand or something like that. So less so with injections, I think, for non-surgical treatment, but more maybe with splinting or plasters or traction or something like that, where in those cases where surgery is not required.